It is a fact that a healthy nation is a wealthy nation. Hence, the health of the citizens must be given premium by the people in authority. Since health is wealth, the workforce of a healthy nation will work optimally, resulting in high productivity, thereby sustaining the economy with abundant infrastructural facilities to meet the needs of the people. Since the evolution of the present administration in 2015, the federal government, led by President Muhammadu Buhari, gives priority to the health sector. The noble step in the right direction has continued to yield positive results. One of such is the fact that in the last 3 years, Nigeria has not recorded a single polio case. How has the federal government, in conjunction with the 30 states of the Federation and the Federal Capital Territory, achieved this feat? This will be our focus on this edition of the program as we host the Executive Director, National Primary Healthcare Development Agency, Dr. Feza Shuaib. My name is Kemi Fakeye. Dr. Feza Shuaib, you are welcome to Stepping Up this week.
Thank you for having me.
Okay, let's start by talking about the success story about eradication of poliomyelitis in Nigeria. Tell us about the feat, how the country gets to this stage.
Right, so we've gone 3 consecutive years without a single case of white polio virus paralyzing any child in Nigeria. That's an amazing feat, given that as recently as 7 years ago, Nigeria was responsible for more than 50% of kids that were paralyzed from poliomyelitis globally. So while we're excited about this piece of work, we're also conscious of the fact that it just heralds another phase in the journey towards certification as polio-free. Now that we've gone 3 consecutive years without this white polio virus, then the regional commission of the World Health Organization will now start the process of documenting all the steps that we've taken to get us here and all the steps that we continue to take that ensures that we actually do not have any kids coming down with white polio virus. So it is really an amazing feat, an important feat that all Nigerians should be proud of, but it also means that there's more work to be done because we have to sustain the surveillance, we have to sustain routine immunization, we have to sustain the quality of the campaigns to ensure that when we say we're white polio virus free, we're actually white polio virus free.
How did you get the record, because we're still having it that some states or some communities are still rejecting vaccination, and do you get to the grassroots in your campaign?
Yes, absolutely. We go not only from community to community, but from door to door, ensuring that every eligible child gets the vaccine. Of course, there are communities where information is not very clear, and they continue to say, we do not want the vaccines. But that is only at the beginning. More often than not, when we, as always, involve traditional leaders, religious leaders in the same communities, then they're able to understand that these vaccines are very safe and they are for the good of the children. So in those communities where we have initial resistance, we've been able to, over time, overcome the resistance once residents are clear that this program by the government is to provide vaccines to the kids, vaccines that will prevent vaccine-preventable diseases. So in the early 2000s, we had huge problems, not just communities, but whole swaths of states that even rejected the vaccine. But over time, we've been able to engage with the states, with the political office leaders, but also we were able to put the polio program, the immunization program, frankly speaking, in the hands of the traditional and religious leaders. And what we've seen is that they've owned it, and they've been able to go back to their communities and assure community members that these vaccines are safe, that it is just rumors about the lack of safety of the vaccines, and it is not born out of any hard evidence. So it's been a very long journey, and there have been so many people, especially the vaccinators, should be very proud of the work that they've done. Over the years, a lot of people have been involved in this progress that we've achieved. This did not just start yesterday or in the last 3 years. It comes from several years, over 20 years of different leaders, different people at the operational level, making sure that in the end, the oral polio vaccine gets into the mouth of the child. And it's a very complicated, very complex operation. But in the end, we've been able to do it systematically, consistently, to such an extent that we are 3 years without a single polio virus. We've also been in the forefront of using innovative technology to get to kids, right? So we're using the GIS, right, to be able to say where exactly the communities are. We've been able to map out where each community is, so that unlike in the past, at the beginning of the program, where campaigns will be conducted and some communities will be left out, now every single community is mapped, every single community is reached consistently over time with the oral polio vaccine, all geared towards making sure no child is left behind.
Okay, well, now, in the past, they will say, okay, maybe from certain age to certain age. Is it routinely now? Is it like all year round?
Yes, so for the campaigns against polio, over time, we've focused more on the kids that are most vulnerable, kids under 5 years of age, right? So we've never changed that age categorization. The guideline has remained consistent, that we continue to look for kids that are under 5 years of age, and we give them the oral polio vaccines, irrespective of where they live. However, for the routine immunization program, as you're aware, is a little bit different from the campaigns, right? The campaigns are those supplemental immunization activities that requires our vaccinators to go from doorstep to doorstep, asking for eligible kids and then vaccinating them appropriately. With the routine immunization, this is something that has been time honored, right? Where our parents, our guardians, caretakers take eligible kids under 1 year of age to the nearest health facility, and ensures over time they follow a schedule where the kids are given the vaccines based on their age, right? That continues, that has not changed. What we have done instead is to continue to add to that routine immunization schedule newer vaccines that prevent diseases, right? So for example, in recent times, we've introduced the pneumococcal vaccine, which helps prevent our kids from coming down with pneumonia or dying from pneumonia.
Okay, towards the sustenance of this campaign, what is the collaboration with state and local government and even donor agencies like with your agency?
Right, so we couldn't have, as an agency or the Federal Ministry of Health on its own, been successful without very tight leadership, very strong collaboration with our development partners and our donors, right? So this is really a partnership. All of what we've achieved has been possible because of the collaboration between the federal government and our donors and development partners. So we're talking about Rotary International, the World Health Organization, UNICEF, US CDC, USAID. You know, the collaboration is so long that I cannot list every agency here, but suffice it to say that, you know, very core development partners, donors such as the Bill and Melinda Gates Foundation have been with us in the trenches, even as we get to this stage. As we work together at national level with these development partners, we've also worked closely with the states and LGAs, knowing very well that the people that we serve live in the local government areas and are governed by the states. So in our collaboration, it's always been a question of sitting down to understand the contexts of each local government, each state, and tailoring our interventions along the lines of what the state and the local government say is the best approach, right?
Okay.
And since we're working with traditional leaders, we always have to be mindful of the fact that what is okay in one context, in one village, might not be okay in another. So we have to listen to the people at the grassroots, understand what is it, what are those things that really motivate them to come out for vaccination, and what are those things that they probably do not find comfortable.
Okay, and what's the next level now?
Yes, the next level now is that there's a National Certification Commission, right? The NCC, that has been trained. So it's a commission of public health experts in Nigeria who are already going around the states and local governments collecting data around how sensitive our surveillance is. So the most important indication of whether or not we have done a good enough job of stopping white polio viruses is to find out if there are still kids under 15 years of age that are coming down with paralysis, and whether this paralysis could be due to infection with the white polio virus, right? So we've been doing a lot in terms of improving the surveillance system. But for the African region of the World Health Organization to actually say that we are white polio virus free, to certify the whole of the African continent, because it's not states or countries that are certified polio free, but a whole region, such as the African region. For that to happen, there has to be no doubt, there has to be no iota of doubt about the fact that there is no child within the Nigerian entity that is being paralyzed anywhere by the white polio virus. So it takes a very comprehensive look, systematic look at all the information we're gathering, taking samples from the environment, taking random samples from kids, looking for any evidence that the white polio virus exists. They also will be looking at how well we're doing when it comes to ensuring that mothers, fathers, guardians take kids to the health facility for routine immunization, vaccination. There's a certain level that we must reach for them to be pretty confident that because we have been able to protect our kids to this level, there is no way the white polio virus will survive in Nigeria, so that it becomes a very hostile environment for white polio virus. That's what we're trying to do. And we're trying to do this not only with the white polio virus, but all vaccine preventable diseases, so that Nigeria, the environment, and our kids are forever free of vaccines that will cause illness and cause death among our kids.
Okay, what are the modalities being put in place to ensure that this campaign continue even after the certification? Because we know that in some developing countries, when they record a fit, they will go to bed and the problem will resurface, in order to prevent this kind of a scenario in the country.
You're completely spot on, right? So this is why for us, even though we've reached the 3-year mark without the white polio virus isolated, we're not ruling out the drums. We're cautiously excited, knowing very well that there's still a whole lot that needs to be done in terms of sustaining all the efforts that will ensure that we do not have any outbreak of white polio viruses. And then how do we aggregate all of the lessons that we've learned from this white polio virus eradication? How do we use all of the lessons we've learned around engaging with traditional leaders, religious leaders, social mobilization, communication, clearly engaging people? How do we use the laboratories that we've built, we've established? How do we translate all of the knowledge that we've acquired in the last few decades around polio eradication? How do we now move them to the next level, like you've said? So we're already doing that. So we've learned lessons from the white polio virus eradication program, and now we're strengthening our routine immunization program. We have a center that we call the National Emergency Routine Immunization Coordinating Center that is using exactly the same model, the same types of interventions around social mobilization, engaging with communities, traditional leaders to improve routine immunization. But apart from that, we're also beginning to look squarely in the direction of the high maternal and child deaths in Nigeria. Nigeria continues to have one of the highest levels of maternal and child death.
Mortality,
That is not acceptable. And this is why we're using all of the lessons that we've learned to begin to tease apart, unpack the reasons why our women die when they are pregnant, unpack the reasons why kids under 5 die before their 5th birthday. And we're going to use similar interventions to make sure that within the shortest possible time, Nigeria attains the glory among nations that when a woman is pregnant, she is not likely to die due to perfectly preventable diseases. That when a Nigerian is born, that child does not die due to perfectly preventable diseases. So we're moving all of this to different programs and ensuring that our indicators continue to be better, that in terms of our ability to execute, to deliver on programs, it's not talk as usual, it's actual action.
Walking.
Absolutely.
The talk.
Yes.
Let's take a short break at this point.
Yes.
Viewer, we'll be back in a moment. Yeah, you're welcome back. The program is still stepping up, and Dr. Faiza Shaib, the Executive Director, National Primary Healthcare Development Agency, is still on the seat talking with us. Before we went on break, you have said so much about what the government is doing concerning the eradication of poliomyelitis in Nigeria and the feat recorded so far. But let's talk about the issue of access to vaccines. At the grassroots especially, it's still a challenge. What do you have to say with it to this?
Right. So in many areas across the land, what the Federal Ministry of Health, the National Primary Healthcare Development Agency, and the partnership has done is to make sure that we devise ways that ensures vaccines are available in the most remote areas. And with that, we've scaled up the availability of coaching equipment across the land. So really, there's more of a change in terms of availability of vaccines. The vaccines are there. What we're now experiencing is a situation where maybe parents are not coming out with their kids. They're not taking their kids for routine immunization the way they used to. You will recall that as a kid, right? Our parents used to take us to the health facilities and make sure that we got all the vaccines that we needed. Yes. But I think there's this misconception now that government needs to bring all the health commodities, including vaccines, to your doorsteps. People are used to the polio eradication program, which will take the oral polio vaccines doorstep to doorstep, right? So people think that every other vaccine should be given like that, but it is not possible, right? The oral polio vaccine is easy to administer. So once you train people for a few days, they're able to administer it. But when it comes to injectables, you need a health worker to do that. So you have to go to the health facility to get the vaccines. So that is part of the challenge that we face. But there's also the sort of issue around geographic barriers, right? Some people live in riverine areas, in hard-to-reach areas, mountainous areas, right? So in those types of situations, we've devised what we call the outreach programs to move the health worker from the health facility to those communities. In a number of places, we've been able to access communities that in the past were not able to get their vaccines because of where they lived. We need to do a whole lot more in terms of ensuring that we have adequate logistics, we have the personnel that will do these outreaches. But for the most part, we've seen an improvement when it comes to the way we are able to reach kids with routine immunization, especially in the last 2.5, 3 years, we've seen a gradual and systematic improvement in terms of the trajectory when it comes to how we're reaching kids. We're looking at close to doubling of the number of kids that we're reaching in the last 2 years when it comes to routine immunization. So yes, the challenges still remain, but no government other than this government, to the best of my knowledge, has done as much when it comes to ensuring that our kids get the vaccine preventable diseases that they need. And the data is there, right? When in 2016, 2017, when we did the multi-indicator cluster survey, the national immunization survey, it was clear that only about 3% of our kids had received Penta 3. As of the last count, we had reached as high as 57. That's almost doubling those numbers. And this is because this government, this administration has really provided the resources, it has provided the technical support through our partnerships to ensure that we actually reach kids with the vaccines that they need.
Okay, what's the agency doing now to achieve the same or record the same feats in the eradication of other communicable diseases in the country?
Right, so with the routine immunization program, we're providing not just oral polio vaccine, right? We're also providing vaccines against other communicable diseases, against other vaccine preventable diseases such as tetanus, such as measles, tuberculosis. So all of these vaccines are part of the routine immunization program. Yeah. And once women present their kids for vaccinations, then they're able to get these vaccines. And then, like I mentioned earlier, the health workers actually take these vaccines to some outreaches, right? Sometimes they go to the household of the traditional leader, they take the vaccines to the market just to move the health facility and the vaccines closer to the people. And we're beginning to see massive improvements in terms of how those vaccines are available. Of course, there's a need for us not to rest on our arse. We cannot say because we have reached 57% coverage that we're good enough. No, we want every child to get the vaccines that they need. That is why the federal government is doing the best that it can. But states and local government also have to put funding into primary healthcare systems, into routine immunization programs, so that it's not just the health workers that are using money from their pockets to get to the outreach sites or to provide vaccinations. The resources need to be available so that governments are able to live up to their promises to provide better healthcare for their citizens.
What are your major challenges?
In terms of our challenges, right? So we're at a point where it is important for our citizens to realize that vaccination is probably the single most important public health intervention that you could ever have, right? And so they should seize the opportunity of free vaccines to take their kids to the health facilities and make sure that all kids get their eligible shots.
Yeah, what's your last word to Nigerians, and anyway, caregivers on the need for continuous support with government and the agency in particular in these efforts to ensure that our children and all of us will live a healthy life?
So the feat of going 3 years without a single case of white polio virus is not a fluke. If you look at what we've been doing in the last few years in the health sector, the fact that we're eradicating polio, we're improving routine immunization, that when in 2014 we had an outbreak of Ebola, Nigeria stamped it out, right? It is a clear testament that we're doing a better job when it comes to providing health for our people. But on the part of our citizens, we also want them to demand for this health, to go to the health facilities and ask questions and be part of the management of the primary healthcare center. Ask tough questions of the health workers and not just leave the health facility and say, oh, this is government. No, primary healthcare centers should have community members involved in the design, in the planning, in the implementation, and monitoring and evaluation of the primary healthcare centers. We can say from the National Primary Healthcare Development Agency that our work to all Nigerians is service, and we take it with the highest level of seriousness, with the highest level of integrity, and will not let Nigerians down.
Dr. Faisal Shaib, it's been nice rubbing minds with you on this week's edition of Stepping Up. Thank you for being our guest.
Thank you for having me.
Viewer, on this note, we shall be saying bye-bye. We hope that you've been enlightened on the activities of this agency and how it is carrying out its mandate for the benefit of all Nigerians. Thank you for being there watching NTA. My name is Kemi Fakeye. Bye for now.